So welcome everyone, good morning. I'm so excited to be here in this R meeting, and thanks to the organizers for giving me the opportunity to speak to you. So my name is Peter, I'm from Sweden, from a company called Verigraft. Today I would like to teach you a little bit about tissue engineering. You will hear a lot about cell and gene therapy in this meeting, but the third leg, as you know, in this area, that is tissue engineering. So, I have worked in this field of advanced therapies and regenerative medicine for almost 25 years now. In 2014, I started this company, and 8 years later, after extensive set of preclinical experiments and data, we could see the first patient being treated in Spain in Europe. And you can imagine how fantastic that day was for me, to see a patient for the first time being treated with a personalized tissue engineered graft. So who are we? We are a classical university spin out from the Karolinska Institute in Stockholm, same place as the Nobel Prize is handed out every year. However, we are headquartered in Gothenburg, which is Sweden's second biggest city on the west coast. So, we are going to talk today about personalized tissues for transplantation. In this way, we can, for the first time, treat chronically and severe ill patients. So, my talk is about creation of organs or personalizing of organs. And I would like to give you a little background to this. So lobsters, this is a lobster. I love to fish lobsters and I love to eat lobsters. But the reason for having a lobster here today is that a lobster is a perfect sign of regenerative medicine. As you may know, if you break off a claw of a lobster, it will immediately start to grow out a new claw on the lobster. Unfortunately, if we are unlucky and losing an arm as human beings, there is no arm growing out again, right? So we need to help Mother Nature a little bit. You see a lot of these type of illustrations in the literature, and you should be a little careful because we can do a lot of fantastic things today, but can we create new organs? This is really not an organ, right? You can't hear just because you have this piece of chondrocytes. There is much more complicated than that. So, is this a reality today? Well, not really. I'm personally a strong believer of printing and bioprinting and 3D printing, but we have to realize that still there are many years before we can bioprint a full heart or a liver or a kidney. That is still 10, 20 years ahead in the future, I believe. So, can we create organs? Well, maybe not really now, but what we can do is to personalize organs and making them clinically useful. So, there is a problem to solve, of course. So, transplantation is ongoing everywhere. Hearts, if you have a failing heart, you will receive a new heart, hopefully. However, there is a big price to come with transplantation. You need to be immunosuppressed with heavy drugs for the rest of your life, right? So this leads to a lot of side effects. Immunosuppressive drugs are the drugs that have the most side effects of all drugs we know today. For example, increased risk of cancer. Also, to live without an immune system is a big burden because you should avoid big crowds. You can die of a simple infection. So, as a consequence, we are transplanting, of course, the big vital organs, but a lot of organs are not being transplanted today because of this risk-benefit balance. But does it have to be that way? I don't think so. So, there is a solution that we can offer today, and that is to use our proprietary technology to personalize the graft before we do the transplantation. I will, of course, tell you about how we can avoid use of immunosuppressants and without causing any immune reaction. So this is how we do it. I would like to have the example of a vascular graft today. So this is a human donor donating a blood vessel. As you know, there are a lot of things composing an organ. One of these things are, of course, the cells. So in the first process, we are taking off everything that causes an immune reaction from an organ. In this case, cells and DNA. We are ending up with a scaffold. You know, if you take off cells of an organ, there will be a scaffold. So this scaffold, importantly, can easily be stored for a long time. Then there is a second thing. I should say that the decellularization is quite generic. That has people been able to do for decades. But for the personalization process, we have a unique method. We are using, instead of pure population of cells, we are using whole blood from the patient. So we are collecting a small 50 ml sample of blood. We are adding some enhancing factors that are our proprietary solution to this to enhance the process. And we can personalize this graft in as short time as 10 days. Compared to if you take out pure population of, for example, stem cells. You take bone marrow, for example, you isolate the cells, you identify the cell you would like to use, you are expanding the cells, typically taking 2 to 4 to 6 months instead of the 10 days we are using. So we are ready to transplant. We have, of course, as I mentioned, a big and extensive preclinical program because we cannot go directly into humans. This is just to show you that after 1 year in a pig, a vascular graft is looking really, really good, and encouraged us to go to the clinical side of the story. So this is angiography. This is a beautiful CD31 staining indicative of endothelial cells. So, as you know, our bodies are full of blood vessels. We have arteries leading out the oxygen-rich blood to the extremities. We have veins bringing back the oxygen-free blood to the heart. In our legs, we have a little challenge because we are animals on 2 legs. So the muscle pump is pumping back the blood to the heart, but gravity are constantly trying to push the blood back to the feet again. So therefore, we have an elegant system in this region, the groin region, a pair of valves or several pairs of valves. So as you can see, very simple but very elegant. When the muscle pump is pumping up the blood, the valves are opening, but when the gravity is trying to get the blood down, they are closing again. Unfortunately, only in the US, more than 2 million people are having failing valves. Then you are in a state called chronic venous insufficiency. And that is problematic because you're starting to get pain in your legs, starting to get swollen legs. And unfortunately, gradually, when this disease are progressing, open bleeding leg ulcers are, if you are unlucky, being formed. So more than 2 million people with this disorder. And unfortunately, today there is nothing on the market that can help these patients because it's not so easy to just create a pair of valves, right? However, this is our product. So we are using, again, if you think back from what I said, this is a donated small piece, 4 to 6 centimeters of a vein with functioning valves, but we have personalized it using our technology. So ready to be transplanted. So this is just how such a product looks like. We are simulating the blood. As you probably can see, the valves are opening when the pump is pumping from below and closing when the liquid is trying to go down again. Anyway, we are now in the first in-man trial in Europe, as I said. It's a small safety trial, 15 patients. And interestingly, we have now the first 2 patients that has gone full 12 months into the trial. And it looks really great. So this is a quite slow trial and a small trial with a lot of, it's called staggered inclusion with some safety evaluation stop points. So we are taking our time. We are soon into half of the patients being treated. So this is a statement from our main PI, Dr. Andres Garcia, just to see the potential of this. So as a company, the business model is simple. We are going to produce and commercialize these grafts in Europe and North America. For the rest of the world, we use an out-licensing model at the moment. Of course, this is something that we are always discussing, the reimbursement model, the health economical analysis, etc. We have, of course, done them, and they look all very promising. So the product, this is a personalized tissue-engineered vein, the product I have described for you now. Our next product is a personalized artery graft. And on the arterial side, there are a lot of solutions on the market today, most of them being synthetic grafts. So they are our competitors. They can partly solve the problem, but there is still a huge unmet medical need because of all the backsides of synthetic material. We are also developing personalized nerve grafts, urethras, heart valves, etc. So they are products to come. There is one exciting thing that I just must tell you, and that is about the future for the donation or the scaffold that I described for you. So today we are using human donated material, and many people ask me, do you think you will be good enough with human donors? And well, that is a question for the future. So we are exploring for our second product, being the arteries, something really exciting, and that is having animals as the donor. And this is a field on strong go, one can say. So sheep, cows, pigs can all be donors. And we are having exactly this now in large animals, and it looks really promising. Then you can imagine we are basically without limitation of donors. However, there is a third, in the future, exciting step. We talked about printing. And to print a heart is a tough one, many years ahead clinically, but the scaffold is much easier. So we are having some programs now ongoing where we are printing the scaffolds. And that is, in our case, a tube of proteins. And that is much lower hanging fruit. So that is something we have in just a few years in front of us. So this is exciting. So we are working with people back home in Sweden on that last program. Just to end up with a few slides, Sweden is a very interesting spot now for regenerative medicine. So we have some exciting programs. The government in Sweden are very supportive now. CCRM Nordic, I think some of you have heard about CCRM in Toronto, and this is a daughter organization formed only a few months back in Sweden with 500 million Swedish crowns from the Swedish government. So that is all exciting. We are a privately owned company with investors, but we have also a lot of soft funding to the company. So just to mention, if someone is interested, we are fundraising right now, and there are a lot of arguments for why investing in this field. So there are, of course, other solutions, but this particular solution, fully biological, personalized graft, is unique for us. So we think there are the medical need, a few competitors in this field, and our data from the clinical trial in Europe is now very positive. So to end up, I have just a few seconds to go. We are very excited to soon start a similar clinical trial program in the US, because we would like to go to the US market. That will happen next year, we hope, and I think the future is bright as for a lobster. So please remember that organs can be formed by nature, and we will help nature, so we will help all of us to regenerate the future. Thank you so much for your attention.